Hi, my name is Angela Bawardi, and today I'll be speaking about hepatitis A. So, the infectious disease hepatitis A is officially known as hepatitis A virus or hepatovirus A due to its classification as a hepatovirus. There's four different common names, though, which are Hep A, hepatitis A, infectious hepatitis, and traveler's disease. The most common name is hepatitis A, which I will be using throughout this presentation. And so hepatitis A first emerged in the 17th century, primarily in association with military campaigns. The first recognized outbreak occurred in Virginia in 1812, during which time the virus was most prevalent among Union troops during the Civil War. And the outbreak resulted in around 40,000 reported cases. And then during World War I and World War II, hepatitis A affected numerous troops with an estimated 60 million cases reported. The outbreak was correlated with yellow fever vaccine and was stabilized with human serum. This outbreak resulted in around 50,000 cases, and so it sparked intensive research into the virus. The researchers found that one form of hepatitis had a shorter incubation period of around 18 to 25 days than another form, which had a longer incubation period of around 90 days. And so the studies revealed that some soldiers who had immunity to hepatitis were still able to develop a second infectious hepatitis. And the findings ultimately led to the development of the terms hepatitis A, which was previously known as infectious hepatitis, and then hepatitis B, which was previously known as serum hepatitis. So, hepatitis A belongs to the picornavirus clade and was initially discovered in 1973. The picornavirus clade encompasses any family of the picornaviridae comprising single-stranded RNA, and it can be made up of causative agents of polio, encephalomyocarditis, hepatitis A, foot and mouth disease, and hand, foot, and mouth disease. Hepatitis A has an icosahedral geometry and a non-envelope structure and measures around 27 to 32 nanometers in diameter. And hepatitis A is the smallest and simplest RNA viruses found in animals, which makes it more difficult and challenging to differentiate its icosahedral shape from any other of the picornaviruses. And finally, hepatitis A is composed of two very fundamental components. The first is the presence of a viral protein, and secondly is that it is positive sense single-stranded RNA. So there are four strains of hepatitis A. We'll talk about hepatitis A a little bit first. Hepatitis A is considered as the mildest and least hostile strain, but it doesn't mean that it cannot possibly develop into a severe or life-threatening condition. Hepatitis A manifests as an acute liver disease with an incubation period of around 14 to 28 days, and it's primarily transmitted by ingestion of contaminated food and water, so basically the fecal-oral route. And so it's more geographically prevalent in regions of the world where sanitation and food hygiene are underdeveloped, like parts of Africa, the Middle East, and Central and South America. And so the first strain of hepatitis A is known as hepatitis B. It is primarily transmitted through sexual contact, exposure to contaminated food, blood and blood transfusion, as well as IV drug use. There's also a risk of transmission from an infected mother to her newborn during childbirth. And so while hepatitis B is generally an acute liver disease, it can progress to become chronic, especially in children that are age 6 or younger. And it's most commonly prevalent in Africa and Western Pacific regions. However, globally, there are around 292 million people infected with chronic hepatitis B, and in the US alone, there are around 2 million people infected with hepatitis B. And the numbers in the US had been decreasing. However, now there are fewer adults being vaccinated and an increased opioid crisis, which is once again spiking the number of hepatitis B cases. Hepatitis B is also the only strain that has a preventative vaccine available. The vaccine is very effective in preventing new infections, and it's recommended for individuals who are at risk of exposure, including healthcare workers, individuals with multiple sex partners, and infants born to infected mothers. The vaccine is administered in a series of doses. The first one is given at birth, and then there are subsequent doses given over the course of several months. And then hepatitis C is the most widely recognized strain of hepatitis virus. There is no vaccine available to prevent it, but there is an antiviral therapy that is very effective in curing around 95% of the cases. And like hepatitis B, it's mostly transmitted through IV drug use, improperly sterilized medical equipment, as well as contaminated blood transfusions. The highest prevalence rate of hepatitis C occurs in the Eastern Mediterranean region, so Jordan, Bahrain, and Afghanistan, and European regions like Germany, Italy, and France, with each region having around 12 million people chronically infected. And so hepatitis D is a very distinct strain of hepatitis virus. You can only develop hepatitis D when someone already has chronic hepatitis B infection. So hepatitis D affects an individual with a chronic hepatitis B. This is now known as a superinfection. And so hepatitis D is an acute infection that can ultimately become chronic. And because of its unique nature as being a superinfection, it highlights the need for increased efforts to receive the hepatitis B vaccine to help control both hepatitis B, and hepatitis D infections. Hepatitis D is most prevalent in Eastern Europe, South America, and Western Central Africa. The last strain is hepatitis E. This is also one of the more mild forms of the disease compared to the other strains. And acute liver failure is very rare in hepatitis E, but pregnant women in their second or third trimester who are infected with the virus can develop serious conditions which can lead to fetal loss or even the death of the mother. And so, like hepatitis A, hepatitis E is transmitted through the fecal oral route, and it lasts anywhere between 2 to 10 weeks. In developing countries like parts of Africa, Asia, and the Middle East, hepatitis E is most commonly spread by drinking contaminated water or anything with the fecal oral route. And then in more developed countries like the US and Australia and Japan, it's mostly transmitted by ingesting undercooked pork or wild game. And wild game is basically like bear or bison. So the World Health Organization has estimated that there are around 1.5 million cases of hepatitis A virus infections worldwide. The primary contributing factor to this is the lack of access to clean drinking water. So within high endemic areas like Asia and part of Africa, the incident rates are highest among in children who are around 7 years of age, but more developed countries like the US and Australia, the increase in cases are usually because of imported foods like frozen foods and a variety of seafoods. There's also an increase in the chances of adults acquiring hepatitis A if they travel a lot or if there's homosexual intercourse between men. So, following a decline in the incidence of hepatitis A cases, there was a spike once again in 2012 to 2013 with 1,500 and 1,700 cases. This was primarily due to the consumption of imported pomegranates from Turkey. And then in 2015 to 2016, the cases again increased by 44.4% because of two separate hepatitis A outbreaks caused by imported foods once again. And then in 2017 to 2018, there were 3,300 and 12,000 cases due to an increased drug use and a growing population of homeless individuals. Also in 2017, there was 91 fatalities because of the uh, increase in cases in 2017 and 2018. And then in 2019, there was a fresh blackberry outbreak in 11 Midwest states, but more specifically in Wisconsin and Illinois, which increased the number of cases of hepatitis in the US. And then finally, as of March 2023, by the time I upload this video, it would be a month from now, 5 cases of hepatitis A viruses were reported in the state of Washington, and then of the 5, 2 people were hospitalized. And then there's acute hepatitis infection and hepatitis-related liver cancer as well as cirrhosis that are estimated to be responsible for around 1.4 million deaths each year. And hepatitis virus of all strains, so A, B, C, D, E, are the leading causes of death globally with around 1.34 million. This surpasses the death of major other infectious diseases like HIV with 1 million, tuberculosis with 1.2 million, and malaria with 719,000. Hepatitis A virus endemicity can be classified into high, intermediate, and low categories depending on the region of the world. And so highly endemic regions include less developed countries where hepatitis A infections usually occur in early childhood. Developing countries experience high infection rates during teenage years. And then in developed countries, there's high infection rates in young adults, and this is probably due to human contact and IV drug use. So there are several vaccines available for hepatitis A, and some of the commonly used trade names are Harvix and Bacta, which can be abbreviated to Hep A. Both vaccines are inactivated and contain an adjuvant, which is aluminum. And so the recommended schedule for hepatitis A vaccine can vary depending on the age of the individual as well as other factors. So for children, hepatitis A vaccine is usually given in a series of 2 doses. The first dose is given during 12 to 23 months of age. Second dose is given 6 months afterwards. For adults, it's also a series of 2 doses, but the second one is given at least 6 months after the first dose. The vaccine is recommended for anyone who's at risk of contracting hepatitis A. So this includes travelers to areas with high rates of hepatitis A, and that's why it's known as traveler's disease, because travelers have a higher risk of acquiring hepatitis A. There's individuals with liver disease and sexual intercourse between 2 men or people who use drugs. For people who are exposed to hepatitis A, in some instances, a single dose of the hepatitis A vaccine can be given within 2 weeks of exposure to the virus to help prevent the infection. And so hepatitis A vaccine is usually given intramuscularly. So in adults, it's given via the arm, and then in children, the vaccine is administered in the thigh muscle. Vaccine is typically not given orally because it has an inactivated viral vaccine, and it's ineffective when administered by the digestive tract. So, in addition to the active ingredients, which is the antigen, the vaccine also has a adjuvant, which is aluminium, and it strengthens and prolongs the immune response. There are stabilizers like sucrose and trellose, which help to keep the vaccine stable throughout storage as well as transportation. And then there's preservatives, which help to prevent the bacterial growth and contamination. And then there are small traces or small amounts of neomycin, which is an antibiotic to help prevent bacterial growth as well as contamination of the vaccines. And then there's sodium and potassium salts, which is just basically a pH regulator. And then to be able to use the vaccine, there's to inactivate the virus, there's a small amount of formaldehyde that is used. And because the formaldehyde is used in such a small amount, there's no concern to humans. So there's a significant proportion of the population that may be concerned about the hepatitis A vaccine and its potential side effects. The exact proportion may vary depending on several factors, so like geography and cultural beliefs as well as religious beliefs. Some of the underlying causes of the concern may include fear of the side effects, uncertainty about the vaccine's effectiveness, and misinformation spread through social media and other sources. So, as with any other vaccines, some individuals may choose not to receive the hepatitis A vaccines, and this decision may be influenced about because of vaccine safety, religious, cultural, or political views, and a general lack of understanding about the risk of the disease and how serious it can be. But in many countries where the vaccine is both recommended and widely available, the majority of the population does receive the vaccine. There is a risk of reappearance of hepatitis A disease in places with inadequate vaccine coverage, especially those that are like susceptible groups, like the young and the elderly, as well as those with immunocompromised systems. So it's critical for healthcare providers and public health officials to address vaccine concerns and to encourage immunization as a means of preventing the spread. And you should note that you will not get hepatitis A from the vaccine, and so receiving the vaccine is far safer than contracting the disease itself. And the side effects are very limited. There hasn't been any reported anaphylactic shock cases, and if there has, it's very minimal. So, yeah. So, these are my references. Thank you for listening.